Joe, take it over.
Well, I'm just going to set up a case that we did a sample case basically just for presentation purposes. Knowing your materials, we milled out same material but different ways, and so Elisa could do a stacking demonstration and just let you know what you can do with your anterior teeth. I mean, I know sometimes the proposals, like you'll see in the next slide, are not the greatest proposals that come out. So I'm just basically going to show you how to tweak them a little bit. I mean, I won't do it physically with the software, it's just a PowerPoint thing. Alright, the initial proposal, as you can see, it wasn't so hot. I mean, it was okay, but you know, I had to lengthen some stuff, lots of things in occlusion. So as you know how to tweak all this stuff. You know, use your move tools and all your other tools there. So that's what I did. Used the move tool, rotated, did some buckle, you know, got into the buckle version, lengthened it a little bit. Let's see. You know, design tools, you use the anatomical tool to basically lengthen your restorations and widen them, like on the next slide. Yeah, so you can basically take, like if you get your anatomy the way you want it and designed on one tooth, obviously you can do a copy. You can copy one to the other or group them. But in this case, I like to tweak just the central, get your midline set, and then you can move one side or the other with the anatomical tool and just move the whole contour instead of just moving it with just one tool at a time. Which makes it much quicker too. So this was the complete design after I tweaked it. I probably spent about 20 minutes tweaking all these after, taking my occlusion and everything, and I generally got it to this point, and then I grouped them. And then I went to the group tool and grouped them all, made them symmetrical, and then I used the incisal variation and took them all down and made them all nice, and I don't have a picture of that, but I did that before I started doing my reducing. So I can have my mamelons on the front without having to cut into them or touch them, anything like that. So this is like all hands free.
Can I just stop you here?
Sure.
Just a little intro. Well, we received this case from a doctor, and it was done for his front desk girl. And she had a very imaginative way that her teeth should look like, and we were talking about a 26-year-old. And she described to us, she sent us numerous pictures, and we milled the set of teeth like this out of LP.
Yeah, out of LT.
A little staining. Obviously, this is eye that she sees something differently. That wasn't.
Well, she saw the initial wax up that you sent over, and,
right.
And they made a temp off of it.
Well, she said that this is not something that she wants in her mouth. It looks just like something that came out of the mill. That her doctor in the office with Cerec machine can do it. So she said that's why I wanted lab to do it. So we went back and forth, and then we realized that for what she was planning to have as a final restoration was something that we needed more preparation from the doctor. So we went and talked, and this is where Cerec comes in really handy, because you know he's right there with the scan, even with us lab. He's right there, and we can tell him like, hey, I need a little more reduction on that 8 and 9 in order to achieve that aesthetic.
So with the Connect,
otherwise,
awesome, right?
I can't get that for her. So she understood that he would take, remove some of her good tooth structure for us to produce what she had imagined in her head. So.
Yeah, and she basically went there and talked to him and told him to do that, which I should have done initially when I saw the Connect scan that he sent us. I should have got right on the phone while the patient was in the chair and said, hey,
yes,
doctor,
you should.
You knew that you need to reduce. And he could have told me to go jump off the bridge, but it didn't. So, and then I always try to align the incisal edges. Because a lot of times you get things shifted and stuff, and take them out of occlusion. So once you take them out of occlusion, your incisal edges can get all misaligned. So always go to the top, and if you have to take your move tool, you can rotate and and shift them back and forth with your move to it. And then look down across the facial. I don't know if you ever held up a model and looked and seen your buccal profiles and see that it's easy to do on the software, which is, I think, is the most awesome thing you can do. Is just rotate the whole thing all the way around and see what your emergence is and your buccal profile.
I think that's one of the most amazing things that you can do with this software, because I think when you do interior cases, I don't even know how people design anything without looking at this way.
Right.
Because that's what we do when we help models together. We look from every single perspective. So, you know, a lot of times you design case, you know, where the teeth are sticking out.
Even with molars.
It's the same thing.
I'm like designing molars on this there, and all of a sudden, like, I put it in the mouth, and it looks like it's an alien instead of
Right. I mean, it's easy to look down that buccal corridor and just round it in with that. And it's really nice.
I think a lot of people like forego this view.
Yeah, it's easy to propose, like, in buccal version, you wouldn't even know it's two-dimensional when you're looking at it straight on, but when you look at it like this, you can actually see the view. And here it was, banging on occlusion like crazy. So this is where we were at the point where I was like, we need to reduce. And it was, you know, in combination with taking a little off the lower incisal edge and removing some of the lingual of the prep area, and he had to roll in the buccal of 2 of the preps. I think it was 8 mostly. It was way out there. So thank God she nipped at the butt there, because it would have been a major headlight, and she would have been totally not happy. So.
What did she end up using?
I think we did these all in LT
A2.
A2.
Yeah, there's a picture of her at the end of this one.
That's a pretty good shade.
Yeah.
So there's the picture. I guess I did. Where I grouped a couple and did the incisal variants and just brought them down before I started to reduce them. So here we did the incisal cutback on number 8. Number 7 we left solid. That's just the solid LT ingot that I stayed a little incisal on it, or not ingot. I always say ingot because I'm thinking press, but block. And so for 8, we decided to just do an incisal cutback, just to do. This is like a minimal. It's a different way to get a little life out of the incisal. You can stain it. You can basically cut back a window on this, toggled it, got it to the orange state, and shrunk it back.
How did you cut that just with the tools?
Yeah, I just cut back this with the tools. Got the window, and you know, in the blue state, or I might just, you know, chamfer this a little bit more, so it's not such an abrupt line from a regular Emax RAM to the block. But so it'll fade a little bit, but this takes away the brunt of the work of just going on, you know, cutting it back. You're getting it to the minimal thickness that you want. You know exactly how much material you can do. You can stain. You can write your name in there. Incisal over the top, and it really doesn't.
That is nice not to have to pull out calipers and see how things
go.
go.
Yeah, it's just this just takes so much time out, and you can do this. It's easy to do. I mean, if you want to stack porcelain. And then we went to number 9, and it was a full buccal cutback. Decided to do this so you can see exactly how much characteristics you can actually put in a tooth and match. You know, this comes in key for, say, if you want to do a cutback for Emax and it's, you know, really strong occlusion. You want to protect that, so you make that veneered window in the front, and you layer this in porcelain, and you want to match, you know, apples to apples, 8 and 9, the hardest teeth in the mouth. This is where this comes in. Did the cutback, brought it all back to minimal. I don't know what my minimal thickness on my parameters were, but I believe it was 7/10, somewhere around there. So that was the window. That's how much porcelain is going to end up being.
You
put
can
down.
see that we have the milled crowns right
We have
there.
them all milled. I have all these milled prior to stacking on, and then I have the final restoration. And then number 10 was a full reduction. So I designed it in full contour and then just shrunk it down. to about 65, maybe 70%. And then on top of that, you can make characteristics. You can staying underneath that all day long. You can get real happy.
That's it.
And that was what we came up with. So now Elisa's going to take it from here, right?
Well, the next slide I think shows just the. Well, this is Kaylee. Kaylee was very happy. Even her mom said like they looked very natural. She couldn't even. And she's smiling, and so I mean she was very happy.
Yeah, basically her baby. She did this.
Yeah, I was very proud that actually I went up and talked to both of them, and we discussed the things that we could better in this case and make her really happy. I mean, she's a very happy camper.